And this is the joint Cambridgeshire and Peterborough Health and Wellbeing Board and Integrated Care Partnership at St Martin House, this fabulous building. So filming and photography are allowed at this meeting, so please feel free to take pictures and use social media during the meeting. Can I ask, though, that when everybody present turns their mobile phones to silent, so it doesn't disturb anyone else who's speaking or the meeting, or turn it to vibrate whilst the meeting is proceeding. And please be aware that this meeting is being live streamed and that a recording of the meeting will be available to view on the City Council's website. There is no fire alarm test scheduled for today, I have been told, so if the alarm sounds, please leave by the nearest marked fire exit and assemble in the car park, which is, actually it's a really long walk that way, so I don't know if they mean the multi-storey or that one. Go for that one. Apologies for absence have been received from John Gregg, so Stephen Taylor is attending as a substitute, Jed Curran, Martin Brunning, Rob Bridge, Steve Barnett, Linda Thompson and Dr Zoe Hutchinson. And may I please ask Martin Wellen if there are any further apologies received?
So further apologies have been received from Louis Camphor, Piers Rickett, Jag Alawalia, Mike Napton. Jan Thomas is on the video, but we've got a problem with the sound. I don't know if Chris is still there. Jan can't hear anybody.
Chris? Is the sound fixed online, do we know? That's wonderful. Are those that are joining us online able to raise their hands if they can hear us? Thank you very much. That's fine. We will rectify that in the minutes. Thank you. Jan, can you hear us? I don't think Jan can hear us. Okay. Okay. We will try to rectify that during the course of the meeting as well. Now, before we begin, I'd like to formally welcome the following to their first meeting of the Health and Wellbeing Board. We have Councillor Graham Wilson with us here today. Thank you very much for joining. And we're also awaiting on Councillor Louis Navarro, who is our new co-chair as well. And what I'd like to do, just for the purposes of the first meeting, it would be a good idea for all of us to introduce ourselves so we can go in a clockwise fashion, I think, would be more appropriate. So I'm Councillor Shabina Kiyum, Councillor for East Ward here in Peterborough. I'm one of the co-chairs of the Health and Wellbeing Board and Cabinet Member for Adults and Health for Peterborough City Council.
Good morning, everybody. I'm John O'Brien. I'm the Chair of the Cambridgeshire and Peterborough Integrated Care Board and one of the co-chairs of this body.
Raj Lakshman, Acting Director of Public Health, Peterborough.
Sally Cartwright, Director of Public Health, Cambridgeshire.
Patrick Warren Higgs, I'm the Exec Director of Adults Health and Commissioning at Cambridgeshire County Council.
I'm Graham Wilson. I'm the County Councillor for Cambridgeshire and Peterborough. Cambridgeshire have been for the last 16 years, and I'm also Chair of the new Adults and Health Committee.
And I'm Stephen Taylor, so I'm the Executive Director of Adults and Health for Peterborough City Council. So morning, everyone.
Hello, I'm Dr Neil Moder. I'm a GP from Peterborough and Primary Care Representative of the North.
I'm Heather Noble, Managing Director of South Place.
Hi, I'm Kate Vorton. I'm the Chief Officer for Integration and Partnerships at the Integrated Care Board.
Forgive me. Good morning. Jonathan Jelly, Chair of Health Watch, Peterborough and Cambridgeshire.
A very good morning to you all. My name is Paul Medden. I'm Chief Executive at Fenland District Council.
Morning everyone, my name is Liz Watts and I'm Chief Executive of the South Cambridgeshire District Council.
Thank you very much. And I think we've got a few members online, so we'll start with Val.
Presentation.
Oh. All right. I'm talking about Val Thomas actually online. Jan Tonham. Why have we got? Okay, yes. Sorry, I thought it was the same window. Sorry, Val. It's fine. No, it's yeah. Sorry. So we've got Jan Thomas actually. No worries at all. And I think we've got Mr. Aluwalia. No worries. And is Andrea one of our presenters? No, Andrea? Oh, she is. Okay. Thank you very much. Thank you. Right, we'll go to agenda item number 2, which are minutes of the Cambridgeshire and Peterborough Health and Wellbeing Board Integrated Care Partnership on the 7th of March 2025. So we're being asked to approve the minutes of the Cambridgeshire and Peterborough Health and Wellbeing Board and Integrated Care Partnership on the 7th of March as an accurate record. And if any board member wants to raise a question on the accuracy of the minutes only, they can do so now. Are we all happy with that? So I see no objections, so we will take that as carried unanimously. Nobody's raising their hands online as well. So on that basis, are board members happy to approve the minutes as written, subject to that change? Again, I would ask anyone who objects to raise their hand now. No. So on the basis, the recommendation to approve the minutes is carried. Now, our next agenda item number 3 is titled Future of Place. Now, for that, we have Kate Wharton and Nikki Ward who will be presenting this, and this will be for a duration of around 25 minutes, inclusive of questions. I'm mindful that we've got a very long day, so please may I invite you to present. Thank you.
Thank you very much, Chair. I'll let Nikki get settled. We've trailed this paper and these conversations at several of our previous meetings, and what the paper in the pack represents, hopefully, is a significant piece of co-production across our partners within our system, looking at how do we create our best approach to empowering place, working as an integrated team to deliver for our population. I think we'd already been on a significant journey in that direction with the establishment of the North and South Place and the building of the positive working relationships and the creation of our integrated neighbourhood teams. And there's a huge amount of work that we need to be incredibly positive and proud of. What we've done in the last 6 months is, in a context which we can elaborate on a little bit further, but quite a challenging context at times, what we've done is come back together to kind of think, actually, what does the next phase of this look like for us? And the work that we've done with a partner supporting us, PPL, a social enterprise who've done significant pieces of work similar in other parts of the country, most notably in London, have kind of supported us through this. And what you've got in the appendix is a headline summary of the report that they've produced as part of a large diagnostic that spoke to quite a few of you over the last few months and worked with John and Heather as our place MDs as well. The context for this piece of work is important because we've been through a period of significant, not necessarily change because we haven't quite got there, but there's pieces of policy that have come through. For example, the Integrated Care Board's blueprint that's been released on actually how does that function within NHS iterate going forward, and obviously the local government review, which a lot of you are playing a significant role in. So in terms of the public sector, a large amount of potential change on the horizon, and actually all of that has just gone to underscore the importance of place, the importance of neighbourhoods, and the importance of being able to, as a system, wrap around our population and almost be the heat shield for those pieces of work as they play through, so we don't compromise what I think we've all been gathering on a routine basis together to make sure that we are leading on behalf of our population for the last 6 months. Nikki, do you want to talk us through the headlines of the paper? And also just to be aware, we've got a lot of people who've contributed to the paper and clear leaders in this field as well. So if there's anything that they would like to also add, I think it would be helpful if they're able to do that, Chair, if we just make sure we're okay for time. Thank you.
Sure, thank you.
Thank you. Bit of tech support. Thank you. So yeah, I think Kate's covered quite a bit of this really. I think and I'm conscious I've got our place managing director, so I'm sure we'll want to add to this as well. I think just from a national perspective, just reiterating that we have had the neighbourhood health planning guidance, which has really underscored the importance of neighbourhood. And I think the opportunity to accelerate what we want to do. And I think this review has really helped us in terms of a point in time and thinking about how we can accelerate our progress in terms of neighbourhood and place. And I think just to reiterate the importance of place and neighbourhood as the changes take place. I think in terms of in practice, as it says in the report, what we've tried to highlight, and actually some of the discussions that have started to take place in our place boards as well, in terms of that real delivery and sense of delivery together, including commitment of resources to those neighbourhood and place footprints to really deliver those kind of true multidisciplinary team working for the benefit of our population. I think that's something that we all share. And just really underline this is about how our teams work together, not necessarily about how staff changing organisations. We recognise that's already happening in some neighbourhoods, so we have got a lot of positive work to build on. So I think really this paper just signals a really exciting opportunity and point in time to really move forward at pace with this agenda and explore all of the opportunities to improve services for our population locally in those neighbourhood footprints. Thank you, Chair.
Thank you very much. At this point, we can take questions. Are there anybody that would like to ask any questions at all? Dr. Moda.
Thank you, Shabina. I guess more of a comment, really. Having had the good fortune of going to NHS Confederation yesterday and hearing from Wes Streeting, who took over the agenda at 1 o'clock with some good messages about the comprehensive spending review, the money that's coming towards the NHS, I guess the challenge across the whole country in terms of the finances of the country. The NHS has been given some resource, however, which I think, people might comment on it being a decent settlement in terms of the CSR, but a challenge really on how we're all going to work together to I guess, turn around the situation. And obviously, having spent about 8 years working on the place agenda, I'm a big advocate for place. I think, the paper from the ICB is really supportive. I think it's really helpful. For me, it is a journey towards, I guess, personalisation of care towards people. It's understanding people in communities. It's understanding where we need to do more in communities, where we're failing people. And it's also, as part of it, with all of the changes around us, it's great to set policy. I think this is in keeping with government policy, but we need to balance off the setting of policy with the doing and delivery of policy. So actually, this is all really positive. It's all really good things. It's all the right stuff. But alongside that, I just want to keep us all focused on what are we doing to I guess, help define what a neighbourhood is. Now, at NHS Confederation, thanks to the support of John, our Managing Director, we were talking about Peterborough, where we sit here today, and we were talking about some amazing work that happens. So, for example, the Light Project and the work that they've done with the homeless population, supported by the ICB, who have commissioned the Light Project to do things, supported by Place, who have, done things like have a bus that can outreach into different areas, supported by the council by actually kind of prioritising this as an agenda as well. And so, where is the neighbourhood for the homeless? Well, the neighbourhood around here is probably Peterborough. where is the neighbourhood for maybe the Eastern European community of Peterborough? That geography might be slightly different. Now, that's where I think, we need to kind of think about how do we add more detail into what are we doing to support this agenda? So from my perspective, a really good paper, really kind of supportive of it. But yeah, just how do we together do more things to help people, communities, and personalisation of care?
I agree, Dr. Mojo. In fact, I did like your post on LinkedIn, which was exactly about what you have just illustrated. So please go over and have a look at Dr. Mojo's post on LinkedIn, which actually describes exactly what we want to achieve by this. Liz, you had the next question. Thank you.
Thank you. I've got a picky point, a substantive point, and a question. My picky point is you talk about, in the local context, you talk about growth, population growth being driven by home building in South Cambridgeshire. Actually, it's being driven by the economy in Greater Cambridgeshire. So we're not building homes just because we feel like it. There is a huge growing economy and a big demand for employees. I just want to clarify that because it is important. My substantive point is about, it builds a bit on Neil's point. So I had a meeting in my organisation a couple of days ago about how we can do this at the South Place and how I can pivot all of my colleagues who are in this space into a more kind of systematic way of working across organisations. And everybody's up for it. There were a few eye rolls and this is what we did 10 years ago, or, we tried this 15 years ago. When I was here 25 years ago, this is how we did it. People never leave South Cambridgeshire. But I suppose my reflections afterwards were that the difficulty of working in this way is that quite often the will is there, but the will can run out if it's not sort of actively supported. And I think sometimes that is about having some budget to do this. I don't think we can say we've all got resource in our organisations and therefore it will all work if we just say we're going to do it together. So I think it does need some sort of financial commitment. And my question was, if the ICBP footprint is going to change, I'm just not clear what is happening at place in other places like, I don't know, Hertfordshire and Milton Keynes. Are we going to have to do another pivot when we get into that bigger footprint, or is that already happening in more or less the same way?
Yes, did you want to come back on that, Kate?
Yes. My mic keeps making slightly strange noises as well, so I'm hoping that no one's interpreting that as being me. Jan's on the screen and she might want to also comment, but I can't see the screen currently. So Jan, shout if you'd like to come in. Don't shout, come in politely. Liz, I think the picky point's a really important one, and I think that's how we kind of are articulating this, has to be kind of worked through together, because I think we instantly go to housing, just like when we're talking about capacity, we instantly go to beds, and I think there is something about making sure that messaging is nuanced. Just your point around, because I can really feel that in lots of conversations, we've been at the place piece, the neighbourhood piece, I think for in excess of 10, 15 years. And actually, if you go back further, my mum was a district nurse and they did place really well then. So it's older than even that. And I think the piece that feels as if we've got an opportunity at the moment is there is a real, as Neil's just articulated, there is a real acceptance that this is what needs to happen to make the difference and to support our population in the right way. And part of that is driven by the fact, obviously, we have a finite resource envelope, and we need to make sure that we can show that that's being utilised in a way that actually is impacting on outcomes and experience. So I think a lot of the conversations that we've been having is how do we get to that point? And this is a bit that Jan might want to come in terms of the development around the ICB footprint and the cluster. I think throughout all of our conversations, place has been really central to be able to make a model that's larger than our current one work. We have to keep place very central as the delivery vehicle, and neighbourhoods very central as the delivery vehicle. So I think that will run through a lot of our conversation, along with the alignment of our model from a place perspective to our unitary authorities as well. Jan, do you want to add anything to that?
language is really important, isn't it? And the report is. I think what we've got to be quite clear on is that the Integrated Care Board has been asked to evolve, and part of when this work started before the ask of the ICBs to evolve. So, so where we've ended up is that this is just the ICB blueprint work has now accelerated the importance of us making sure that we have really strong partnership working locally to enable neighbourhood teams to really focus on those that most need services. And I'm afraid we're going to have to be quite unashamed really in healthcare sense, because demand is outstripping capacity, workforce is really struggling, and therefore we have to do things differently. And what the blueprint says is that over a greater scale we will have to commission integrated neighbourhoods to work in a far more coordinated way. And to Neil's point, when we talk about place, there's integrated neighbourhood teams, but there's also the kind of utilisation management that we need to look at to make sure we're able to identify those individuals most at risk, and those neighbourhood teams are able to respond. So I think this place work is really important, but I think we should use it as code as the moment we try to liberate providers and partners to work together to come up with the right solution that really deals with that utilisation and those workforce challenges that we've got, and us working as a bigger footprint. I think that the notion that potentially, if you look at it on paper, we're going to be working across a number of different counties, a number of different combined authorities, and potentially 8 places that we all need to work for their local population. So it's going to be complicated. There are no doubts, but that reset that the blueprint has said isn't just about place. It's about the importance of place, realising that they are the delivery vehicle for the integrated neighbourhood teams, and minimising the risk and maximising the opportunity of improving people's outcomes. And that's what we need them as not just partnerships, but delivery vehicles to do. Kate, I'll hand back to you.
Did you want to add anything, Kate?
No, I think that covers it. Thank you.
Okay, well, thank you. Next, I have Patrick.
Yeah, thank you. I think overall the council would be supportive of this. There are naturally governance arrangements, so member scrutiny and the need for more detailed consultation would happen and would have to happen for this paper to then be supported by the council. I think the other bits that we just have to be concerned about are the imminent changes with the ICB and the longer term changes as a result of local government reorganisation, and the potential implications and impact that would have on this model and the way that we look at place and the way that as organisations we look at place. So I think they're just aspects that we need to be bearing in mind as we move into those next phases of structural and organisational changes that's affecting many of us.
Thank you for your comment. Heather?
Thanks, Chair. I just wanted to say from a place point of view how much we welcome this. There is a lot of talk about what needs to be done, and it always gets harder when you get into the how it is done, and learning about what works and what doesn't work. And in North and South Place, we've been paying a lot of attention to that, and making a lot of taking the learning from that and also doing a lot of stuff. So I think we've got a lot to offer, a lot to contribute to the system in terms of efficiency and productivity gains from integration, but also learning, bringing together the knowledge. Lots of people know what works and what doesn't work, like the people in South Cambs District Council who've been there and seen it, but we need to bring that together, and that's why having place as a forum where you can bring that knowledge together and get listened to, I think, is the other thing that I'm really hoping for, that as place gets more scrutinised and is more accountable, we will have a greater, a stronger platform to share that learning and improve along a different line, a different avenue of improvement than we've been taking over the last 10, 15 years.
Thank you for your comments. I think we have John Rook now.
Thank you. I really welcome the report, and I think the strategic aim is really positive. I think we should look at this as a real challenge for the Health and Wellbeing Board. For why is the future looking more neighbourhood shaped? And that's because that's where people live and work, that's where their social connections are, that's where their outcomes are formed. And this comes, I suppose, with a really hard edge of what is the experience, access and outcomes for residents within a neighbourhood. And that's how we'll be judged, and that's how we should challenge and judge ourselves. What is it like to get a dentist? How quickly can I see my GP? How joined up are my services? How many times do I tell my story? Are things we should objectively measure at the Health and Wellbeing Board, said, are we getting better and better at these things? Because that truly does actually drive then access, outcomes and equity for residents. So I think a data-driven approach to how effective these models are is really, really important for the Health and Wellbeing Board, not just if we got models and diagrams. And to be blunt to the Health and Wellbeing Board, the fairies aren't going to come and help us with this. This is going to be the contribution of partners to supporting access and outcomes and experience for residents.
That's music to my ears, John, because it's something that I've commented on often here, that we have the same conversations again and again, and actually having an audit process in place I think will be beneficial to this as well. I next have on the screen Jonathan.
Thank you, Chair. It's very easy for me as the Chair of Health Watch to sit here and say, amid all this upheaval or reform, depending on your point of view, we mustn't ever lose sight, of course, of the patient voice. But I say that in particular sense about this transition that we're all going through. We're obviously close, hopefully, to the 10-year plan, and for us, the Dash 2.0 review as well. I think a bigger geography, you could say at a macro level, could be bad for the patient voice to be at the centre of things, but that's entirely mitigated by what's in the plan about making place and neighbourhood truly work. So I'm very much with Neil's comments about delivery, always for the patient. But what I would just like to say in conclusion, Chair, I know, having worked with colleagues, how much they know that, but I feel obligated as a patient voice to put patient in every sentence that we talk about almost. So thank you very much.
Thank you, and we're very complimentary of Health Watch's role in that as well. So thank you, Jonathan. I next have Sally.
Thank you. Just wanted to say broadly, very supportive. I think it's a really good paper that's trying to capture a lot of different elements of this work, and I just think it's a point in time. But as others have said, the detail will come as we work it through, and I think it's a really good opportunity that we need to not lose around getting the momentum and the structures right around this to then now this kind of point in time to drive it forwards. Completely agree about being data-driven, and I think while everyone nationally is trying to do this now, aren't they, and it's really gaining that momentum, there will be growing evidence base as well around what works that we need to be making sure we're learning from as well. And just a plea that, and it is already, and the conversations I'm having are the right ones, but around public health being really key to this as well as kind of being able to work with population data, thinking about the evidence base, bringing prevention in and really kind of being at the heart of some of the conversations. So I just think it's a real opportunity to work connected in this space.
Thank you, Sally. I next have Paul.
Thank you, Chair. So it's a variation on the theme from me, really sort of on the back of what colleagues have already said. So absolutely supportive in principle. I think it's a really important piece of work that's been undertaken. Obviously, the whole system's challenged by uncertainty right now. Despite that uncertainty, public service reform can't idle. it still needs to be progressed. I think we hope that as we get greater clarity in terms of some of the changes that parts of the system are seeing, we can probably sort of further accelerate these important changes. And indeed, it's absolutely essential to respond to the changes that we're seeing in the system, obviously specifically within health, the changes we're seeing in local government reorganisation, obviously the issues around devolution of the government's white paper and where mayoral combined authorities are concerned, and how all that sort of stitches together in the coming months and years. I think I would very much sort of echo Neil's point. I think taking this policy at a high level, how it converts into practical and effective delivery mechanisms that can be seen to deliver the right kind of outcomes for residents, patients, and add value to the system over and above what we currently have. Thank you.
Thank you very much, Paul. John, you wanted to add something?
Thank you, Chair. So I suppose 3 points really. One, the genesis of all of this piece of work, of course, in a sense, predates both the local government white paper and the ICB blueprint. But I think regardless of the change, I will come back to the change, but regardless of the change, the potential of place for all of the ambitions that we've had in this forum and that we all share as partners, I think is sort of commonly held. So I think it's really good that we are sort of focusing on it and focusing on how we can evolve and improve that from where we've been. And also that it's an enabler around neighbourhood health, which apart from the guidance that Nikki described, I think is probably likely to feature in quite a significant way in the NHS 10-year plan due in the beginning of next month. So, and I think we all probably share that view for the reasons that both Neil and John sort of alluded to, that actually what really happens on the ground between partners in changing people and communities' lives is what matters most, leaving aside the big politics and structures. So actually trying to get that right is important. I sort of come back to the sort of change point which Liz and Patrick, I think, both have referred to. I mean, you know, we obviously can't pretend that having significant changes in the footprint and the structure aren't going to have some bearing about, you know, what a future ICB may think about. But what I can say is that we have really emphasised in our conversations with others the importance that we attach to place and devolving to place. As Jan said, on a bigger footprint it becomes ever more important that we devolve that. And certainly the responses from our fellow ICBs with whom we might work more closely with has been very positive, and it reflects very much, I think, the philosophy that they have taken as well. And we've talked about, well, it would be sensible, wouldn't it, for places to be something that broadly align with future unitary local government structures. They've been receptive to that point as well, and indeed again reflects some of what, at least in one case, they already do. So I sort of think whilst we can't pretend that, you know, we can sort of sew up the future entirely amongst ourselves, I think that spirit and that direction of travel is very clear across those partners. So I hope, going back to Liz's point, that in terms of sort of having to pivot again, I'm sure there will be some pivots, but I think they're pivots within what is a sort of broadly agreed philosophy about how on a bigger footprint that might work.
Thank you, John. Thank you for your comment. Stephen.
I can barely reach the microphone. I'm kind of like, it's a good job I do a bit of yoga at times, isn't it? To kind of like, yeah, in child's pose there. No, I think follow up. I think a lot of the points that have already been made. I think it's really welcome the report. I think it's really positive that there's a real kind of national focus now on neighbourhoods, because I think we do really believe in neighbourhoods and the impact that you have and the importance of focusing on neighbourhoods. And I think we do welcome that kind of national sort of push now and that real kind of focus that we've got on it. I think as organisations, we do have a lot of work going on within neighbourhoods. We do have a lot of individual organisational work that we do. I think we call it targeted prevention. It's that bit around how do we target our preventative offer on, you know, on different communities, different needs. I think it touches on exactly what Neil had kind of said there, that how, you know, John's point around data, I think we're starting to understand, we're starting to get much better data, understand it in much more sophisticated ways than we've done before. I think we've got kind of public health now really sort of focusing on those kind of wider determinants of health and understanding. And a lot of kind of predictive analytics work that I think that's around at the moment give kind of real opportunities. And I think it feels as though within the place arrangements we've had, I think within kind of the parameters that we've had, I think there's been a lot of work, good work that's been done. But I think, I guess my call would be for the ambition, really. I think that we need to kind of up that a bit in terms of looking at kind of structures, looking at how do we, you know, we've got a lot of resource between us, haven't we? We've got a lot of kind of services, you know, a lot of organisation, community health organisations, acutes that we've got. How do we use them in a properly kind of strategic way that I don't think we've done before, kind of locally? And I think the willingness is there, the opportunities are there. You know, we can start to plan, can't we, for what LGR brings? We've got a kind of rough idea of what it's going to look like. We can start to plan around that, I think, around kind of what we need to do. So I think it's about how do we get that governance right, isn't it? So I know, Kate, we've talked quite a bit of now, how do we get a kind of a shared governance that brings those kind of different bits of work that are happening in lots of places in a kind of a shared, ambitious programme, I guess.
Thank you, Steve. Dr. Moder, or Neil.
Thank you, Shabina. Just reflecting on some of the comments, I mean, I think, you know, it is well worth hearing Wes Streeting's address to Confed if you've not heard it. You know, I'm sure we can circulate a link. And he talks quite eloquently of, you know, despite the increase in funding or funding being prioritised for the NHS, this kind of mismatch between then public's experience and public's kind of feelings towards the NHS and their care, and the fact that actually, you know, as John said, some of this is just real stuff. There's real stuff about reflecting on, for example, GP practices. How can patients access our service? How do we use our capacity in a better way? How do we work with other services to do it? And I think, you know, when we took this to a clinical directors meeting in the north recently, there was appetite amongst the GPs to actually start doing some of this really granular work that would change the way that people experience services. And so I think it is, you know, for me, just to help, you know, to make it real, it is kind of really all of us, whether you're an ICB, a Health and Wellbeing Board, in the council, kind of thinking about the granular things that we will actually do. You know, later on the agenda, there's the obesity drugs, and I'm sure we're going to have a really good debate about obesity drugs. People have different views on it. But I think as we start to tackle these, how do we tackle it in a place-based way? How do we tackle it based on neighbourhoods? How do we understand that different communities need different approaches? That's what we should be thinking about as we do business. So if you're sitting in an ICB, that's what we should be thinking about. Thinking in a local authority, that's how we should be thinking. If you're a GP practice serving the community, that's how we should be thinking. So the way that neighbourhoods become real is by us grasping this agenda and changing the way that we do business based around the neighbourhood agenda. Thank you.
Thank you, Neil. I think that's really key. Yes, Mark, thank you.
Brilliant, thank you. I think partly building on that, Neil, I think there's something to be said about recognising what you alluded to, the difference between neighbourhood and community, and recognising that the neighbourhoods were randomly drawn bits that fitted with GPs, and that's not how people think, and people think about their community, and that could be, like you were saying, a wider community if you're homeless. I think the other thing is, and again you alluded to this, it's the difference between data and knowledge from the community. So absolutely the data is important, but equally as important is what the community is saying is important, and they are the bits that if you can influence, the community will recognise that change. So with the best will in the world, if you drop the obesity level by 4%, most of the community are not going to notice that. If the community is saying to you what is really important is, I can't get a dentist, and you do something about putting a dentist in, then that will be a positive input as far as the community is concerned. So I think it's just recognising neighbourhood's important, but community is important as well.
Thank you. Kate, you wanted to give a summary or respond to some of those comments? Thank you.
If that's okay. And it's just lovely to hear just the strength of feeling on the direction of travel. I think we're all collectively pointed in the same direction. And I think we've got some time together later this afternoon. We had some time together in development session at the last meeting. I think it was the last meeting. And we're about to talk about an action plan as well that came out of that. I think there is a lot of collective work that's already gone, but a huge challenge for us as a group of leaders in a system now going forward to commit to, actually to Neil's point, how we start to think through a lens with all elements of our BAU that actually is focused in this way. And I think we do that already, but potentially often in our organisational silo. And just to make the link to the development sessions and the conversations we've had previously, and it's detailed in the paper, the Health and Wellbeing Forum and the Integrated Care Partnership is a really powerful group of individuals, but also in terms of how we begin to feed this grouping with the right data, with the right understanding of what's happening at a neighbourhood level, how that's impacting our outcomes and our experiences of our population. That needs to become kind of like the business rhythm of the agenda population, what information gets put in front of yourself as elected members and us from a group of officers' potential perspective. So I think that we've done the legwork now. We've had lots of really healthy conversations, all violently agreed. It's the operationalising of it now. And then as a group, from a governance perspective, overseeing the delivery and having some core pieces of data that we routinely revisit to make sure actually we are making a difference and we can point to that. And if we aren't, then actually how do we course correct collectively rather than as an individual organisation?
Thank you. Before I conclude, are there any more questions, comments at all? None? Well, I think that this is a really strategic report, actually, and some of the things that have come to my mind, which I'd like to talk about more in an honest fashion. I think I'm incredibly privileged to be sitting here, both with a clinical hat on and also from a representative perspective as well. I would like to say that I would like it to be noted regarding whatever the geographical or demographic footprint is eventually, we are clear on our distribution of resource and don't lose sight of the fact that those areas of austerity are overlooked in favour of more affluent areas. That's something that I've thought about quite recently. Something very minor, actually, abbreviations in our reports, if we could just sort of PPL, BAU, I've got to sometimes think about what that, and also for the sake of our new members as well, who aren't very familiar with abbreviations, so that would make things, I think, a bit more clear. In terms of working with various stakeholders over the delivery of this project, I think transparency is going to be key. So who does what, where, the roles of the authority aligning with the ICB in delivery of this model is going to be key as well. And with whatever our geographical footprint looks like from a local government review perspective, I think that Raj, who's our new public health director, and I have been talking about how we align our priorities with that ongoing geographical footprint when the ICBs form as well. I'm also concerned about digital efficiencies. I know that that's one of the arms of this report, and often in digital efficiencies we see a whole lot of resources put into upgrading and remodelling, but I'd really like to see focus being placed on digital efficiencies whereby we have sharing of information across stakeholders. We know that that's a problem. We know that sometimes information is not easily accessed and it takes time. So that's something that I really would like to be focused on as well. And even referrals to various agencies and stakeholders, it's important that we have these digital efficiencies so that the voice of the patient, as Jonathan says, isn't lost out as well. I was wondering whether a consultation will be taking place with the public to gain their views on this. That's something that I haven't really seen in the report, to see what their perception of this changing model will look like and what their priorities are, because we've already had quite a number of views from people around the table with reference to that. So these are just some of my summing up comments at all, and was wondering if you wanted to come back on any of that before we move on to the next item.
Thank you, all very useful. I think on the last one, I think, and maybe it's a broader point as well, we are not essentially changing the model. We have a place, two places, we have neighbourhoods underneath them. I think what we're talking about is empowering and getting clearer line of sight on some of the governance. I think the conversation with the population and the work we do, the point you made around referrals and how confusing it is, we've been having the conversation this week with Jess, Jonathan's CEO, around that, how the public experience that, our systems, and how to navigate that and how tricky that can be. I think that I'm happy to bring something back, but I think that we probably need to knit the pieces of work and the conversations we're having together. But obviously understanding kind of what that means from a neighbourhood level, place level, system level as well. And I think your point around the austerity areas and that gap, that lends itself to the work that I think we're already committed to, but hopefully we should get better line of sight on around inequalities and understanding kind of resource allocation as part of that as well. Sorry, last point, digital efficiencies, that absolutely is part of the conversation, and we've got, hopefully, I'm sure it was talked about at the Confed, we've got moves nationally along those lines, I think, which hopefully should help us with some of those conversations also.
Thank you very much, Kate and Nikki. So, after that report and some useful conversation, the Health and Wellbeing Board and the ICB is asked to agree to proceed with the implementation of the broad approach recommended in the PPL report and to work towards a place-based model of integration where all partners are signed up and committed. The second point is the Health and Wellbeing Board and the ICP is asked to note the importance of place as part of an opportunity to reset our approach and go further and faster in operating in a more integrated way for the benefits of our residents and in the context of prospective ICB reconfiguration and local government reorganisation. The third point is commitment from all system partners to engage in future Health and Wellbeing Board ICP work to support implementation of the recommended approach and to establish clear priorities and mechanisms for delivery. This should include areas of delivery that support integrated working at the local level to improve outcomes for our population. And the fourth ask is to a commitment to regularly review progress, not only in delivery of outcomes for our population, but to promote culture and behaviours that support this shift. The specific reporting mechanisms are being developed and will be brought back to the Health and Wellbeing Board, recognising the context of prospective health and local government changes in architecture and the need for the board to establish a clear line of sight through to place and neighbourhoods. So I will take it the board is happy to support this recommendation unanimously, unless anyone indicates otherwise now. Patrick.
Just on to recommendation C around commitment from all systems partners to engage in work. I just think there needs to be the recognition around individual governance within partners around the table, and while we would need to take that certainly through member scrutiny from the council, and I'm sure other councils would feel the same. So there just needs to be that understanding that that stage has to happen for us to fully commit to it. There needs to be some further scrutiny within the council.
Thank you. Thanks, Patrick. I think that we can make a note of that. Is that right, Martin? And incorporate it within the minutes. Would the ICB like to add anything at all? Kate, are we happy with that?
No, I think that's very sensible. We can put an extra couple of lines in.
Thank you for that sensible suggestion, Patrick. So we will insert that as a recommendation. And are there any other points that anybody wants to raise? Otherwise, we can agree the recommendation with the implementation of Patrick's suggestion. That's fine. Thank you very much. Now, we go to agenda item number 4. Thank you very much, Kelly and Kate. Or is it Nikki, actually? It was Nikki, wasn't it? Nikki and Kate. Thank you. So, agenda item number 4, which is the Board Development Action Plan, which is going to be presented by Sally Cartwright, Kate Wharton, Liz Watts, Heather Noble and John Rook. Who's leading?
Shall I?
Thank you, Sally.
I don't think we'd quite prepped. I'll spare Kate's voice for a minute and I'll just talk through and then we can just open to questions.
Thank you.
So just as a reminder, we had the LGA development session a few months ago, and a subgroup have been meeting to think about what does that mean we take forward, and how do we go from here to think about some of the actions and thoughts that came up through that development session. So we've got a draft action plan that's the appendix to the paper, and some proposals around what the key themes within those are. We do also have the development session this afternoon that will unpick some of this a little bit more and just think in reality, how do we then take it forward, so that we can have a bit more of an involved discussion around some of it this afternoon. But I'll just talk through the themes that are in the action plan and some of the key things that we're already taking forward, and then I'll open up to questions. So the key themes are around strategic leadership and purpose. So making sure that everybody is really clear, and we don't lose sight of what the leadership, what the purpose and role of the board is, and how we are as leaders within that setting, and don't lose sight of what we're trying to achieve and the priorities that we have as part of the strategy. Relationship management with system partners, so that we're connected in a really meaningful way to similar to the conversation we've just had actually around neighbourhoods and place and wider system. And the expectations of people that are coming to the meetings to take things away to their organisations and their wider system that they're working within, so that we're working as a whole system. Thinking about the strategy and making sure that we are, again, not losing sight of that, but really thinking about how do we enable and mobilise place as a delivery partner for that strategy, and keep working in a coordinated way to those system priorities. Making sure that the governance is right, so there's a clear line of sight and reporting arrangements between the place-based partnerships and other system enablers, and keeping sight of the board's purpose through everything that we're doing, having a really good structure to the quarterly meetings and workshops, and keeping sight of what we've said we're going to do, and how are we going to then actually do it to make a difference. And then related to that as well, data and intelligence, to make sure that we are using the right tools to enable us to direct our work to the right population groups or to where the need is, but then also making sure that we keep track of the impact that we're having through the right metrics and a dashboard. So I think previously there was a lot of work done on a dashboard of outcome measures and how we're going to monitor, but we've just sort of lost sight of that. So we just need to refresh that and make sure that we are all sighted on what difference we're actually trying to make. Are we making that difference? And then, as said before, course correct if not, but really keep sight of that through the board. So those are the key themes that the action plan is developing. We've already started, using this setting to really mobilise the system. Also within that, strengthening the SRO role. So we've got our priorities, and I think we've again lost sight slightly of what the strategic leadership on those as a role means, and how do we keep that momentum. So we've got some proposals to strengthen that, and then we've got the further board development sessions, and then we just need to think about how do we keep this, and are we getting it right, and how do we kind of maintain this direction of travel that we have. So I'll stop there, and the action plan is the detail in the paper, which is a draft, and we can shape that through the discussions as well. Thank you.
Thank you, Sally. Do we have any questions at all? Keeping in mind we've got a development session coming up this afternoon as well, and Councillor Wilson, it will be your first opportunity to be a part of that session. Anyone at all? No? I think it's pretty straightforward, isn't it? Yeah, so we'll go to the recommendations, which are the Health and Wellbeing Board ICB is asked to comment and approve the Health and Wellbeing Board ICP Board Development Action Plan. B, to agree the draft Health and Wellbeing Board ICB Board Development Action Plan 2025 to 26. And C, to agree a further LGA facilitated development session to review progress against the action plan in 6 to 9 months. So I take it that the board is happy to support this recommendation unanimously unless anyone indicates otherwise now. We're all agreed? Those online as well? Wonderful. Thank you. I will take that as unanimous. Now, thank you very much for presenting that, Sally. It's very comprehensive and covers everything I think that we need. Agenda item number 5, I take you to. I'm mindful of time because we've got a very long session today. And agenda item number 5 is the JSNA update. And for that, our presenters are Sally Cartwright and Sarah Dugan.
Thank you. So I will just hand over to Sarah, who's on the screen, to talk through this proposal. Thank you.
It's a bit crackly.
Shall I try? And then, Sarah, if there's anything that I missed, because you're closer to the detail, then we can just about hear you, but it's not great. But I'm sure we can cope with it to answer any questions if we need to. So the paper is building on previous conversations we've had around the JSNA approach. And just for anybody that's new, just as a reminder, the JSNA is the Joint Strategic Needs Assessment, which is a statutory requirement that's owned by the Health and Wellbeing Boards as a way of looking at our population needs to inform strategic commissioning. So it's a jointly owned piece of work between the NHS and local authority, often led by public health intelligence teams, to develop that evidence base to inform what we're all doing and prioritising. And we have been doing a lot of work in the last few years on the JSNA, and we have got into this model where we have very detailed topic-specific JSNAs that come through. And we just need to, there's lots of great information in there, but they haven't necessarily been driving the right, or been enabling people to think, what do we actually do with all of this? And what do we then need to prioritise and take forward? So we've been doing a lot of thinking outside of this meeting around how do we refresh that so it's easier to manage, more visual, has dashboards, is more easy to update, is more efficient and more manageable for both those people that are doing the analysis and also for us as a board to then use the information and think about what does it mean that we need to be doing, and maintain that focus on the priorities that we just talked about. So actually it's really relevant to the conversation that we just had around how we're developing the board and how we're keeping sight of data and knowing that we're making a difference. So the paper proposes a new look and feel for the JSNA, which clearly has a structure that we'll try and manage and tries to limit to around 20 pages in length. But there are additional pages that can be added in for each of the headings if needs be, depending on the topic. But broadly, the content will cover the title, some summary infographics of the top issues, so the top challenges, top recommendations, some scope and strategic context, why it's important for us here or nationally, or why it's a topic of interest, the overview of the issue for us in Cambridgeshire and Peterborough, health inequalities, so what are the key population groups that we really need to be thinking about through the issue, what the evidence base is of what works to tackle the issue, some community and service user views, then a summary around what we're already doing, so it may be commissioned services or it might be something else in the system that's already happening in that space, and then some recommendations for improvement and future development, and we try and limit those to 10 really recommendations that we can really take forward as a system. So there's a template draft in the report as an appendix that you can have a look at and start to see how it will look. And I'll stop there. Have I missed anything, Sarah? Is there anything you wanted to add?
Did you want to add anything, Susan? What's wrong with me? Sorry, I'm getting names wrong today. Thank you very much for that presentation. Is there anybody that wants to ask any questions at all around the JSNAs? Yes, John.
I just really wanted to comment and say thank you to Sally. I like the the format, and I like the fact that we can sort of aggregate up from some individual dashboards to the overall one potentially in time. I think it's sort of really helpful that we've thought about the link between the sort of SRO structure we've got, in the board more widely and JSNAs, because I suspect we've probably at various points in the past sort of seen those as sort of slightly separated from each other in an unhelpful way. So I think that's good, and I recognise that the way that eventually plays out, we'll see how that evolves. But I think that's the right intent. So I just wanted to welcome it. Thanks, Shabina.
Thank you, John. Yes, Mark, thank you.
Just quickly around the stakeholder engagement bit, just to make sure that we are looking to involve those, from my point of view, those specialist voluntary organisations in that particular JSNA, and that's about making sure that folks like myself get time to find that right person and get them involved, because I think that's key. But I think there's also something about how we pull out cross-cutting themes across all of the JSNAs. There's a danger with the JSNA that it starts to look siloed, and I'm one of those people, a bit like Liz, who's been doing this for too many years now, and I think it's important that we recognise those. Not Liz, sorry Liz, I've been hanging around the sector for too long, and it is, I remember sitting doing JSNAs many years ago and recognising that there were certain themes that appeared in all of them that sometimes got lost. So how can we ensure that that doesn't happen?
Thank you, Mark. Would you like to come back on that, Sally?
No, only that, yeah, noted, and yeah, I agree. So we'll keep that in mind. Thank you.
Marge, did you want to come in response to that?
Yeah, I think that's really important, Mark. And I think what we did last time was we looked at how the mental health JSNA, the children and young people's JSNA, and the healthy places JSNA all had some common themes. We pulled that out and then developed an action plan. So yeah, I think it's really important that we look at them in the whole as well as not in their silos. And we did that. I think that worked well when we did that.
Thank you. Heather?
Thank you. Just thinking about the recommendations and the opportunity to link them in a bit more with what is practically available to be done in the local context, I think is something, another opportunity that place brings us to sort of do a little bit of co-development about the wording of the recommendations so that it's easier for people in individual organisations to connect with them actually and think about what they're practically going to do.
I think that's a reasonable comment. Thank you very much, Heather. Paul?
Yeah, thank you. So I think the proposal, what's set out, looks good. I think it's a really good piece of work. I think what I would say is, over the years, I've had many versions of JSNAs presented to me. Clearly, it's really important evidence base on which we identify key interventions to make a difference across a range of areas. I think all I would say is, and I've said this, to previous versions of the JSNA, and I think you've sort of hit the nail on the head, Sally. It's about how it does drive priorities, how it identifies them, the delivery against those priorities, and there must be measurable outcomes associated with it. Otherwise, we'll continue to be having conversations around health inequalities and essentially a kind of a flatlining position. So, any sort of rearrangement, restructuring of the JSNA, if it can be even more focused on making a difference, I think that's important. And, on the face of it, hopefully this helps to do exactly that. Thank you.
Thank you. Thank you, Paul. I next have on the list Councillor Wilson.
do call me Graham. That's why I kept saying. So I like the suggestion. My immediate thought was, how do I present the information to the committee that I chair, so the Adults and Health Committee in Cambridgeshire? And I'd like to try and understand how we can extract the relevant information very easily. Looking at the Nottinghamshire example, which I think is a superb example, it talks about recommendations and then it talks about all partners should. So what I'm interested in is, so what is the responsibility for Cambridgeshire County Council in all of this, or Peterborough City Council? And the final thing is, it doesn't mention anything about risks, and it talks about the future, but it doesn't say and if you're considering the future, there are these risks to take away as well. So that might be something to consider. Thank you.
Thank you. Did you want to come back on that, either of you, or just happy to note those points?
Happy to note, that's helpful, thank you.
We now have Patrick.
So I'm just going back to the earlier paper on the place and just thinking around how we make sure the JSNA not only thinks about Cambridgeshire and Peterborough, thinks around on a place base. So we're much more evidence-based on that, both in terms of the JSNA, but also the way that we then interpret that in terms of our actions as a result.
Thank you. Sally, do you want to come back on that?
Yeah, I think that's a really good point, and I think sometimes probably in the JSNA, as we've currently had it, one of the weaknesses has been where we've been on too big a footprint, and then it masks some of the inequalities or priorities at a lower level. So I just think we definitely need to be mindful of that as we go forwards.
Thank you. So I can't see anybody who has their hand up online. Martin, did you want to come in with something, I believe?
Sorry, for the presenters, we've had a request from the people online. Can you stop sharing until your item starts, please? Because it's distorting the online view. But until your item starts, and then it's disappearing online as well.
Thank you very much, Martin. I'd just like to raise the point that members have said in the room around sort of losing sight of what our priorities are. Obviously, you know, I think data-heavy reports are something that we've raised in the past, obviously, with sort of, it's important to have that information. Evidence base is incredibly important to try and, but also there's a very fine balance, isn't there, between giving relevant information and also wanting to have measurable outcomes, which I think is going to be key over here. I do like the visual aspect of it. 14 pages, it's still good compared to what we used to have before. But yes, I'm encouraged to see how this works going forward, having a look at how JSNAs have evolved over the years. So no, thank you very much for presenting that report. So on the back of that, do we have, yep, Sally.
Apologies. I just wanted to make one last point around the proposed, in section 4.2, which is the proposed schedule for the next JSNA topics. So just for people to be mindful of that, and if that doesn't feel right, then there's still scope to change them. But what we're proposing is that we have employment and health coming next. Then we have an annual update of progress against all of the priorities, and looking at the demographics and inequalities and outcomes around all of those. And then in March, we'll have housing and health as a deep dive topic. So that hopefully should show some good alignment to the priorities. And I also just wanted to just do due diligence, can't get my words out, and just thank both Sarah and Helen from the Peterborough side for the work on this.
Thank you. Thank you very much to all that have presented today. So, if there are no further questions or comments, the Health and Wellbeing Board and ICB is asked to agree the detailed approach for the new JSNA process and timescales, and having a look at point number 4 in the report that Sally has alluded to. Are we all happy with that? Great, that's wonderful. So thank you very much. I will take that as unanimous. We now move on hastily to agenda item number 6, which is our priority 3, update, where we will be having the right Val Thomas coming to present and not Jan on the screen. I invite you to please present. Thank you very much.
Fun?
It is, yes.
Yes, am I the real? Yes, I am. I've lived myself for a number of years, I know.
Valadak aptly casted Jan out the way while messing with the screen on the previous item, so yeah, no, she knows where she stands.
No comment. Apologies for that. We had to make sure the technology was working, and we thought it better to be premature rather than taking time in the item. So for people who were taken off the screen, I apologise. I also apologise for my voice. I've lost it for the past couple of days. I think I've got it back now, but Nikki's going to step in, and she's formerly the ambulance service, so I'm sure she can cope with any emergency. So thank you. And also on the screen, Nikki's also here. She will be obviously feeding on on to work well, but also Andrea is also on the screen, and she is the SRO for this item, and she's from the Cambridgeshire and Peterborough Combined Authority, and she's Assistant Director for Skills and Employment. So I think in view of the discussions, I'd like to preface both this paper and the next paper by combining them. I think originally this was to give an update on where we are in progress and so forth. But in fact, it's at a very opportune moment that we are doing that, given the preceding discussions. I think the changes around, well, it's not a change around place, as many people have said. Many people have been working with a place focus for many years, but it's certainly accelerated and developed more recently. Then there's been a lot of policy, national policy, coming down in this area. And thirdly, the organisational landscape, which has changed. And I think what this does is provides an opportunity to look at what we've done so far through those lenses, and what are the opportunities and what are the challenges by those changes. I think in both areas, we've really tried to work as a system, or at a local system, and even at a hyper-local level. And I think what the learning from that has been very much that understanding of needs. The benefits of collaboration and integration have really been shown through some of this work. But I think underpinning that is that constant looking for that alignment, looking at what needs to be, what's missing that could make these developments much more, have much more impact, identifying the synergies, but also then that goes back to that data and having a data-informed approach. And I think we have very much room for development of that. And I think the preceding discussion and what the JSNA could bring to us, but also to capture the work that is happening through data. So I'm saying that now rather than repeating it again for obesity. I think there's the paper and a number of recommendations at the end, but I'm going to go through the presentation, asking Nikki and Andrea to also contribute, and the recommendations at the end of the presentation certainly won't go through all the detail, but more to give that sort of impression of the work that's been happening, but also to stimulate thinking, how could this work be developed with board support? So let's hope this all works now. Just quickly going back to the strategy that we put together a few years ago, and that then became incorporated into the Health and Wellbeing Board and the Integrated Care Partnership, this board, and the focus on getting people into work, if they want to stay in work if they have a health condition, and then the other side of it, making sure that if they are in work, that it's good work in terms of the working environment, terms and conditions, and so forth. And I think that probably holds. But I think there's been so much noise nationally about our employment in terms of economic inactivity and our employment rate. And you'll see there the aspiration, the national aspiration, we have an employment rate of 80%. Cambridgeshire is not too far off it, and Peterborough has a little way to go. And there's lots of detail in these slides, so I'm just going to pick up the headlines. One of the main, I think, the main focus on all the policy changes has been economic inactivity. That is, people they haven't been, the technical definitions that they haven't been looking for work, and they've been out of work for longer than for 4 weeks. And the main cause of that is health and disabilities, but there are other causes, carer commitments, looking after families, and even early retirement falls into that as well. And I think what the data there sort of breaks that down. This one here, does my cursor show up on that? Oh, it does. This particular graph looks at 16 to 64-year-olds and how that is broken down. I always think students skews it a bit, this data, because it does show a very high rate amongst that population, but for obvious reasons. Again, I don't think I'm going to go too long on the data, otherwise we'll be swamped. I won't have any time. If you look at, I think this one is interesting, particularly in terms of that 16 to 24 age group, in terms of economic inactivity. and where Cambridgeshire and Peterborough sits, which is above the United Kingdom figure. And if you look at the figure for 16 to 64-year-old, it is way above that figure. And that is an area of concern for our not in education, employment or training. And I think the other rates there show where we stand, the employment rate and the unemployment rate, where we stand in comparison nationally. Cambridge and Peterborough just breaks it down there again in terms of how the different groups that make up this economic inactivity, where it broken down actually in the long-term sick, again students, which I think skews it a bit, but it does show how we compare to the UK. Right, the next session, the next slides is very much about what have we been doing, and I think when we set out on this work, we had a number of ambitions, and that was very much developing a whole system approach in terms of how we work across different organisations to support this. And the second ambition was, first of all, to do some pilots, which adopted an integrated approach to supporting people back into work or to stay in work. Then along came Workwell, which I'm going to ask Nikki to talk about, which built on that learning, but also was able to utilise the networks that we'd built up in the previous years. And then something about the workplace itself, and a good work charter and anchor institutions. So I'm just very quickly going to run through this. 2 pilots were started, one focused in the south of the county and city and south. And I think they had a more challenging role. They were focusing on people who had been out of employment for much longer. And I think the evidence shows if you're out of work for 3 to 6 months, then it's very difficult to get into that mindset to get back into work. I think this provided a lot of learning. It worked very much in the community with community groups, which is a slightly different approach from the pilot where it was embedded into Penland District Council, which I'll come to in a moment. But it did actually very clearly demonstrated that progress was measured in terms of how much people had moved from that I can't work into I can work. And in fact, we had 13 job offers, which out of 130 participants of a very challenging group, I thought that was very good myself. The second pilot was the Penland Help Hub Access model, and this built on work that Penland District Council had already started around the development of a community hub where you could bring people together, bring people and where they could access various forms of support. And this pilot was built into that, so we had a very same but different types of support. But the key themes were that people got individualised support to assess where they were on their journey into work and where they needed support. Most people have multiple needs, not just health and health issues or disability, but it might be housing, it might be just rock bottom poverty. And there are a lot of things to deal with, and I think these 2 pilots really identified how you can support people by starting to build that integrated model. And along came Workwell. These are just some statistics which on the Penland Hub, which shows I think it shows the involvement of different organisations, because if you look at the referrals and the signposts, it tells you where the referrals came from. And that's the kind of network that was built up through the pilot. But it did lay the foundations. Workwell.
Yeah, thanks, Val. So I think Workwell, I think people are quite familiar with here broadly. We brought it here quite a lot. But I think given the conversations that we've had already today, it's a really good illustration of what we are able to do as a system. So obviously, as Val's alluded to, very clearly an ambition, objective set within our system-wide joint strategy, something that we wanted to work towards together in partnership. It really is about a personalised care support, something that we were talking about earlier, and the delivery of it, whilst very challenging, we had to stand it up over quite a short period. really gave us an opportunity to build on what we'd learned in our pilots, establish something locally for our population, and to really try and understand how we could best support people who initially were coming with work and health needs, but as we discovered had a range of needs and an opportunity to really live and breathe what we mean by working in partnership at neighbourhood. And I think all partners represented around this table and beyond have really stepped up to work in partnership on the ground to deliver work well. So it's a really good illustration of what we can do in quite a short period of time. So I'm not going to go into the data significantly, other than to say that unsurprisingly, I suppose, people arrive with a whole range of needs, employment, housing, food, and what the partnership approach in our Work Well hubs has done has ensured that we've got those connections and local ability to respond in a quick way to people's needs. And I think that's been really important, and the feedback that we've started to see from people who've used Work Well has been really positive. So much so that the hubs have now gained quite significant national attention, and we hosted at our South hub at the Mind base, CPSL Mind base, who lead in that patch, Dame Carol Black and Professor Van Stolt from a National Research Institute and Government Advisor, and also the National DWP SRO for Work Well. And they've also come to a summit and heard from all of our partners who are leading the delivery, from our district council colleagues and voluntary sector partners who are delivering the range of hubs across our geography. So really exciting. We have received quite a lot of exciting signals, shall I say, from the spending review. We're waiting to see how that pans out, but it looks like there will be an opportunity to continue Work Well. As I say, look, there's a huge amount of data. We're waiting for formal evaluation nationally as well, which will really help us track individuals so that we can look at both the short and long-term impact that this programme has had. So there'll be lots of data to share moving forward. These are the things that we get measured on at the moment, so the participants that have a plan. And you can see really from that how we've really accelerated the numbers, and quarter 1 is looking really good for this year in terms of the numbers that we're delivering as well against the targets that have been set. In terms of the future as well, we've got Connect to Work, and I know Andrew might want to come in and say about that, but again, I think a true demonstration of how we're working in partnership as a system, working with colleagues in the combined authority to look at how we build on Work Well with Connect to Work and really start to enhance our offer with this agenda. So just a really exciting demonstration of what we can do as a system for our population. Thank you.
Thank you, Nikki. Mine off. Right. Thank you, Nikki. And I think Nikki set the scene very much for Andrea. And I think we had work and health, but we always knew there was something missing, that whole sort of skills arena. And I think the national local policies that sort of emerged since about last October as really, I think will really take this whole area of work forward and bring all the key elements together. But the important thing is that we align. And I think we are doing that very well, firstly, through the efforts of many people. So, Andrea, are you here? Great. I think it's to introduce basically the overarching get Cambridgeshire and Peterborough working again, and then the constituent parts within that Connect to Work and the Youth Trailblazer.
Yeah, it's a bit echoey, but please continue, and if anybody has any problems, we can have a look in it.
leading on. The paper also talks about some growth accelerator areas around integrated care systems, and also about Connect to Work, which is another key programme that I'll talk to you about a little bit more. If you could move on, Val, please. So for our area and our Get Britain, our local Get Britain working plan, it's a key plan that will sit alongside board, but these are two particular programmes to have in mind. If you can move on to the next slide, Val. So this is a real introduction to the plan and what it's going to cover. So as we've said, the government is keen that all areas have an 80% employment rate. And when we look at it across the combined authority area, we're near that. But Peterborough definitely sitting around 70% has got a way to go. So that's a key area of focus for us. The plan will set out and identify our labour market challenges and show how we're doing sort of locally in tackling those challenges. And I probably need a whole day with you to kind of talk about the wider skills and employment agenda, but there's a lot happening in the space. And this particular work we're discussing today is a key contributor to that. The paper also sets out proposals around transformation at a level of Job Centre Plus. So Job Centre Plus and the National Career Service will be merging, and the combined authority is very much involved in that transformation and working to ensure that local plans and local services take account of those changes and are looking to integrate those services within the wider work as well. And obviously, the plans are encouraging local areas to work collaboratively, and that is something that we are already doing successfully in the region. So myself, Val, Nikki, and colleagues from Job Centre Plus are meeting frequently to discuss the plan and to move it forward so that we all agree and endorse the proposals within it. Next slide, please, Val. So these are some of the problem statements that have been recognised nationally in the Get Britain Working Plan, and you'll see that there's a lot of similarity between the challenges that we also have in our economic and activity groups locally, but it also starts to kind of draw out things like the wider labour and skills shortages that is holding back growth. Really hard to fill vacancies, and obviously a lack of growth does start to undermine living standards. But it's also recognising there that actually insecure and low paid work can be a problem for some, and the contribution that makes on a poor quality of life and starts to impact on health. And it also highlights there things around work retention and progression for carers, and in particular people who are in work who've got mental health or physical health conditions. And across the region, 74% of our working age population have actually cited a mental health or physical disability. So we do have a significant amount of our workforce actually in work with conditions that require support. So we want to take the opportunity to look at that and look at addressing not only the individual but also the employer. So there's some key groups there that we're looking at and that will feature as part of the plan. These outcomes have been set by the Department for Work and Pensions in terms of what they want the plan to really start to address. So clearly there is the target there of reducing health-related economic inactivity, also looking at reducing the disability employment gap, tackling the NEET rates amongst young people, really looking at increased employment rates of women and returners of women into the workforce, and looking at reducing the kind of local disparities between employment gaps across the different authorities across our region. And the government are also interested to look at the gaps between employment rates of lone parents, couple parents, etc. So that's another kind of area that we're starting to explore. So Connect to Work is a key kind of programme that will be delivered as part of the kind of Get Cambridgeshire and Peterborough working plan. Connect to Work has previously been called, under the previous government, Universal Support, and it was to be the sister programme to Universal Credit. But Connect to Work is about delivering a local supported employment programme for economically inactive individuals. And across our region, we've been working collectively to look at what this needs to look like in terms of a systems approach. And the visual here kind of represents the kind of totality of partnerships in a place working collaboratively together. So the combined authority is the accountable body for Connect to Work, working with the ICB as our strategic partner. And what we hope to do is to commission a prime organisation who will work across the spheres within that infographic, really including our Workwell hubs, recognising that they can play a pivotal role in the triage of the services across the other kind of place-based support services that people are accessing. And that this is also can only be successful if we continue to strengthen the relationships across the primary and secondary care services, but also with employers and trade unions. So we have got a strong partnership already with our Cambridgeshire Chambers of Commerce, but also with our businesses linked into our economic growth teams across our constituent councils, and also working with trade and sector bodies, because we can only move people into work if jobs exist, and we need to obviously work with employers to generate them. So this systems approach will not only kind of enable the delivery of Connect to Work, but it will also hopefully continue to develop the integrated work and health system for our region. And I think the next slide is just a very quick overview of the actual supported employment model. It follows an individual placement and support, the IPS model, which I know some of you might be familiar with. It also covers off the SEQF quality framework, which is a more kind of complex needs programme for people who are perhaps further from the labour market and need more kind of place and train models to get them into work. But the delivery of Connect to Work has to be quality assessed through a fidelity model, and we'll be working with providers to deliver that. We've done some work with our constituent councils around priority groups, and the list that you can see there is what the government gave us to kind of pick from. We've very much been clear that actually all of those groups are a priority, and as we shape the programme and look to deliver it from late of this year into early next year, then we will look to target those particular groups across the region. So that's a brief on that. In terms of the youth guarantee, similar problem statements here. We know that economic inactivity is at a 12-year high for the age group. Val's kind of shown and shared the disparities in the unemployment data for our young people. Excuse me. I think we're all getting croaky. Excuse me. So we have developed these list of problem statements to help develop our policy framework for our youth guarantee. So the youth guarantee is a particular policy that's looking at supporting 18 to 21-year-olds who are NEET, because at the moment across the country there's no statutory body responsible for that age group unless you've got an education, health and care plan or you're in care. So the government are looking at how perhaps combined authorities can start to take that role forward. And we've been working very closely with Cambridgeshire County Council and Peterborough City Council as existing statutory bodies for NEET at 16 to 18 to look at how we can scale up the tracking and the monitoring, but also develop a policy framework more linked to employment than education to move people forwards. Next slide, please, Val. And so this is
sorry, Andrea, I'm sorry to have to interject. Is this a very long presentation? I'm just very mindful of the time. We've got two other
this
agenda
is my last
items.
Slide, and then I'm handing back to Val.
Thank you very much. Thank you.
Okay. So this is just a summary of the Youth Guarantee Policy Framework. Just starts to really highlight some of the key areas that we're focused on, of which you can see there one is around health, mental health and wellbeing, working closely with our ICB and care services to strengthen the support for young people. But by developing this policy and developing the services that sit within it, we hope to be able to successfully tackle some of those challenges around NEET. Thank you.
Thank you, Andrea. So there was an awful lot in there, and I've just got a couple more slides to go through. I think we discussed about those getting people back into work, but it's also the workplace itself. And I think we did sign up in the beginning to anchor partnerships and a good work charter. And I'm just going to ask Nikki to very quickly synthesise the work on anchor.
Yeah, so I can.
So I'll just interject, if you don't mind. We will have to wrap up this item, inclusive of questions, by 11:55 at the maximum, if that's okay, so that we can introduce the next item on obesity. And we will have to wrap that up by 12:10, so that the other two agenda items can be discussed, because we do have to break for lunch for 12:30 because of the development session in the afternoon. Just to give you an idea of timeframes, if that's okay. Apologise for interjecting.
No problem. Thank you, Chair. Just very quickly, this is something we're committed to within our strategy. There's a piece of work going on across the system, bringing in a range of partners to work on what this actually means in practice. And the lead for this is planning to bring back a paper to this forum later on this year. So I'll leave it there. Thank you.
Briefly about, thank you, she's very good. Briefly about the Good Work Charter, which is something that's going to be led by the Combined Authority, but it's very much working with employers around certain standards in the workplace. So I won't dwell too much on that. And very briefly, you have these slides. Actually, these are slides that came from the Chamber, but actually shows the challenges for the employers in terms of getting employees. The last slide of recommendations to the board. And I think they focus on refreshing our health and wellbeing strategy, revisiting the targets. I think we had a target about getting a percentage of people back inactive, people who are economically inactive, back to work. I think we need to look at the targets that our ambitions more broadly in the context of these policy changes. Then there's the evaluation of the Work Well model and what that will mean for the development of an integrated approach to employment, and then supporting all the new policy ambitions. And one of the key ones is about working with employers. All roads lead back to employers, essentially, whether they can adapt to people that have certain demands in the workplace, what terms and conditions they have, and the workplace environment. And yesterday, in the meeting that Nick has described, this came back time and time again. How can we strengthen our relationships with working with employers? So that is something that it's an ambition, and we certainly need board help with that.
Thank you. Has that ended the presentation? I do apologise for the interjections. It was a wonderful presentation with a lot of information that was very relevant. Do we have any questions from the floor at all? None at all? I just wanted to... sorry, Kate, please. Was it? Raj?
Yeah, I just wanted to check, in the strategic partners, should we also have place now? Because it just says ICB, but if the ICB is becoming big, should place be the strategic partner, considering they'll be big employers as well?
So conscious, place colleagues here. I think it flashed up as a slide very briefly, but certainly from WorkWell perspective, absolutely, place are the key leads in terms of coordination of our delivery of work and health. So absolutely, key strategic partner. Thank you.
Thank you. Kate?
Mine was related, so I just wanted to acknowledge how much heavy lifting has gone on with our place teams and actually with our multi-sector organisations, and I think that there was a huge amount in the presentations, but also I think people have been really passionate, and that energy and drive has driven what's been a tricky agenda to land at times. But when you listen to the stories from the people that have used the service, they're incredible, and they are absolutely encapsulate, almost like what we're here to do and what we should be motivated to solicit more of. So it's brilliant that hopefully this is now going to continue.
Very relevant point made, Kate. Thank you very much for that. And Dr. Moda. Neil.
Thanks, Shavina. So I mean, I love this program. I think it's a really good program. I think that a lot of one of the commonest places for people to start not being at work is through support from their GPs, and often we're in a difficult position, which is that we're trying our best to think about how we support people, but then sometimes the way that we support with time away from work then sets up a trajectory. I guess what would be really helpful, and I've not seen it and it may be available, is just what is the data showing? So I think the statistics are showing that about 80% of this work has happened in the north, which is great to hear as North Place colleagues around the table, but actually it would be great to see what the statistics, so what's the impact of this programme, where are those kind of case stories and things like that. Another sort of facet of the Work Well programme has been about kind of personalised care budgets, and my understanding is that personalised care budgets haven't been utilised that much, and obviously that seems like a bit of an opportunity really, because actually supporting people with budgets towards their mental health, their physical health and things like that seems like a really good opportunity.
Thank you very much. I've next got Patrick who wanted to ask a question.
So this looks really good. I suppose from a selfish perspective, the groups I'm thinking around are carers, people with learning disability and autism, and people recovering from poor mental health. And how are they being considered in this? How are we making sure? Because it's a piece of work that I need to press on, and I'm not sure how we get around the table so that that group are part of this consideration.
Thank you. Did anybody want to come back on that point, actually?
He's going to answer Neil's, and I'll answer Patrick's.
Yeah, thank you. Obviously, general practice as well, I meant to say earlier, been an absolutely fundamental part of Work Well delivery as well. And again, it was recognised the amount of general practice colleagues who have taken and run with this as well in terms of referrals. Absolutely, in terms of data, we do provide a huge amount of data. There's a local evaluation group that's starting to really, obviously we're waiting for sort of statistically significant numbers to work with. We've certainly got the qualitative data coming through. Happy to do more about sharing that, but we are awaiting some of the national evaluation to kick in, which we think will be quite exciting in terms of what that will dig into. And the personalised support budget, we're actually taking a paper through the ICB Commissioning Investment Committee next Friday in terms of how we ramp that up as well, moving forward, and make better use of that at scale in terms of the budget that's been allocated for Work Well. Thank you.
Thank you, Nikki. Val, did you want to come back on Patrick's point?
Yes, I think in relation to we have a strategic group that overlooks all this work, and that is represented by, for example, adult social care, both from Peterborough and Cambridgeshire. I think, yes, it's very clear. I think Work Well is, although it's prescribed, is very iterative. And we have to make sure that those are built into that programme, but also have the links to Connect to Work and the Youth Trailblazer as well. So it's kind of work in progress, and we're building the pathways all the time. But I do think we now have very good representation on the oversight, the strategic oversight group, to ensure that that will happen. And I'd also like to take the opportunity to say, I bring the information here, but there's a huge amount of work and a lot of people involved in taking this forward.
Thank you, Val. I'm going to take John's as the last question, if that's okay with members. Please forgive me, but in the interests of time. Yes, thank you, John.
Thank you. Collaborative leadership and action Work Well. Really, really positive to see the contribution of all the partners to this. So I think it's a really good example for the Health and Wellbeing Board. We take an objective and we really, really drive it at a local level. Really, really positive. Two areas I wanted some assurance about, if that's okay, please. So one of the really good bits of Work Well was how we used local assets to drive some of the delivery. I just want some assurance that introducing a prime provider for Connect to Work won't damage or harm our ability to mobilise as quickly as we did with Work Well, and that will actually add to, not take away, some of the local involvement and drive of that. And then secondly, just looking at some of the data, particularly around younger people in Peterborough and Fenland, how are we disproportionately going to focus on those areas of significant need in terms of worklessness in those particular areas? Thank you.
Nikki, would you like to answer that, please? Thank you.
Andrea might want to come in as well. She's nodding. But very briefly, just to assure, and I'm sure Andrea will reflect this as well in the conversations we've had, absolutely about that localism being important, and that's why we've said about Connect to Work, building on what we've already got in the Work Well hubs, really, really important. And we know that that's been the art to the delivery of this real local, personalised support, picking up on those mental health needs, knowing what the local mental health support could be be for individuals and a whole range of other things as well. So really important, but Andrea, you might want to add to that.
Thank you. So yes, just to add that we've made it clear in our market engagement for Connect to Work that whoever we work with from a prime perspective, we expect them to subcontract local services and to work across that consortium of local services. We had a market engagement session last Friday, which was attended by a range of organisations, and we made that very clear in our model. We certainly don't want a prime to come in and take over and displace the fantastic work that's already happening. And just in response to your point about young people in Peterborough and Fenland, this is about making sure that for Connect to Work and the Youth Guarantee, that we're making sure we align adequate resource into those areas in proportion to the number of people that are currently economically inactive. So that's a piece of work we're doing at the moment. Thank you.
Thank you. Thank you, Andrea, for that. So we will close that agenda item, and we therefore ask the Health and Wellbeing Board and ICB to approve and support, number one, the progress described in the report in areas of ongoing development, and number two, the recommended next priority areas to be taken forward to contribute to the achievement of the priority 3 ambitions. Can I take it that the board is in agreement with those recommendations? Thank you very much. And thank you very much, Nick and Andrea, for taking part in this pivotal piece of work and all of your very hard work. Please excuse the interjections once again, I'd like to stress. Now, our next agenda item, I'm very mindful of time. What I would like is for us to close this agenda item inclusive of questions. So Val, a very big ask, but may I humbly request we just emphasise on the main points because we have another agenda item. I'd be very grateful. And that is around obesity. Would you like to put your microphone on?
Actually, I think it might be a good idea. Okay, the high-level ambitions, going back to the data. I've summarised them in the paper that supports this, but I think overall, we've seen a stabilisation in the surge of childhood obesity that we saw post-COVID. I think as regards the other rates, it's very difficult to tell at this moment in time. I think it looks a lot, 6 targets, but I think your point about obesity drugs, I don't think we want to lose track about just focusing on medication for obesity, but things like physical activity, that is about being healthy and that's about being preventative. Again, I'm going to not go through this data because I think you can see it and there's actually a data appendix. But there is one point I think should be made. The inequalities persist, very much linked to deprivation, and it's across all the indicators. So I think the data's there. That briefly outlines our early ambitions based around schools, looking at what the science says about health behaviours, and then very much more focused on clinical pathways, obesity-related conditions, and secondary prevention. The next slide very much just outlines where we are, and I think we've achieved those ambitions, but I think we've done much more, and that's very much comes back to place. And in the next couple of sections I'll whiz through is about saying what places run with this, but what more we could do with a more structured approach to place. But you'll see the examples there, but I'll just give them. I've sort of taken that famous squirrely diagram and related it to a place-based model in terms of the key areas that we have happening at the moment, and how they have come together in so many points. I think there's an example here of both Aperture authorities have introduced policies around advertising. I think that's great progress. We've had a school-based project which in Cambridgeshire, it's just in Cambridgeshire, and that's reached over 20,000 children, and we now have schools taking forward their own projects they self-fund. A huge range of active travel that goes from the system-wide initiatives around infrastructure through to more local initiatives that are seen there in the slide. The next slide is very much for neighbourhoods and what the neighbourhoods have been doing, and usually a lot of this work is a mixture of the integrated neighbourhood teams, but actually working with GP practices, working with the district authorities, but also working with county and Peterborough City Council as well. There's some really good examples of some joined up work, and those are just a few of them there. And there's sort of some nice sort of pictorial images. East Camp's Healthy Awake community appointment days, the free weight management programme, and at Meridian Primary Care Network. There was funding provided to districts for them to develop programmes, but the programmes have always been developed around place and with partners. Again, so those were just examples, I think, of where that wasn't in the original plan, but it doesn't matter because I think at place, partners have run with it and they've developed programmes. And if you go in each district, there are programmes that have been developed which you would say support this agenda. So moving on to Our Healthier Future, and this programme is a joint initiative between Public Health and the ICB. And it's that early identification, using the population health management approach for the early identification and treatment of people early, but also pinpointing to wider preventative interventions. And we have 4 clinical areas, and one of them is lipids detection and optimization, which is, I'm using very sort of health terms here, but basically it's high cholesterol levels. And addressing them through treatment or through better lifestyles, for example. And I think you can see there that it involves practice sign-up. We've got around 84% of practices signed up to this. Through a data tool or a data system tool, people are identified as being eligible, they are at risk, they are contacted, and then they are offered to be seen and an intervention. And you can see nearly 6,000 people have responded to that. And a number of people have commenced on treatment. But I think the significant impact of this is that when I started this work in about 2022 with the ICB, we were very much red. We were very red across Cambridgeshire and Peterborough. And I think we've now moved into the green in terms of the ICB that has the lowest numbers or prevalence of people with high blood pressures without a diagnosis. They haven't been diagnosed and therefore they haven't been treated. And it's the most improved ICB in the east of England. So, next steps. Am I fast enough? I'm trying to go as fast as I can. So, again, there are opportunities afforded by the changes. So this is a proposed strategic plan or framework for taking forward these prevention priorities around obesity. 4 main areas of focus: children and young people, place, neighbourhoods and communities. And I will say within that, just picking up on Mark's point earlier, this is very much about engaging communities in this agenda. And I think we have examples, and I'm thinking particularly in East Cambridgeshire and to some degree in Peterborough as well, where communities have been engaged in this and they see it as an issue for their community. The second one was continuing the work on the more of the clinical pathways and secondary prevention. And then that whole system approach, particularly around things like active travel, looking at us as being a major growth area, the new developments, what we should have there, public sector commissioning and anchor institutions. There are a whole range of actions and policies which could influence those areas, but absolutely key and in red are those health inequalities and inequities and the impacts of poverty and how it influences obesity. And obviously there's certain enablers in there. But shifting to what's happening nationally, I think if you look at the impact we've had on smoking and how smoking rates have dropped, albeit not in all groups, but you can see where major policy initiatives have had that impact. And I think it's, as a system, the support for national policy, for changing national policies, is an essential part of our system, because those are the things, those critical changes in terms of how food is sold, advertising, the aggressive advertising that we see. Again, this is the policy environment focus. It's the evidence that, where we've done there is map the different types of evidence against various areas. But I'd like to draw attention to that public policy, how that encompasses all of those areas. And on the right-hand side, an example of some evidence-based policies that we could support locally and where the responsibilities for those lie. Just picking up a very good example of this is fast food outlets. And I think what that diagram is saying there, or what that image is saying there, is that deprived neighbourhoods have 5 times more fast food outlets. The out-of-home outlets have less healthy menus compared to more affluent neighbourhoods. Online food outlet access is greatest in the most deprived areas. People living in areas of higher deprivation are exposed to more advertising and therefore encouraging the purchase of high-fat, sugar and salt foods. National policies that are related to this, which are kind of in circulation, relate to sales, advertising and targeting. So recommendations to the board acknowledge the improvements that have been achieved against the target ambitions, support the proposed refreshed strategic framework and the development of a realistic number of actions for each strategic ambition, support the development of local policy and planning initiatives along with actively articulating support for national changes. All right, and I'd like to end it there. Thank you.
Thank you, Val, and thank you for all the hard work that you've put into those presentations. Do we have any questions at all for Val, please? Yes, Neil?
Sorry. Excellent paper, very well presented, especially in difficult circumstances. Well done, Val. I guess, and it's not to be challenging, but I don't think place, from my perspective, I don't think place was involved in this as much as it should have been. Okay, so I guess in my future vision of the world, what would happen is we've got a problem, we want to reduce lipid, we want to get better lipid control. Instead of that going to a centralised Cambridge and Peterborough ICB function, that challenge goes to North and South Place to think about an approach that works best for its population. So I think the narrative of places involved is true. So the delivery mechanism of a lot of this benefit comes through place, i.e. comes from individual GP practices, it comes from voluntary sector, it comes from people doing it. But this solution that was come about has not come through place, would be my reflection. I think a bit like the Workwell, just reflecting on the Workwell conversation, Workwell personalised budgets is going to a centralised committee to think about how we might think about how budgets are then used for personalised care budgets. I think this is the thinking that we need to change into where there are opportunities involving place at the position where decisions haven't been made. So how do we as place influence, work alongside this agenda to get where we are? But that's not to take away from Val's paper, the recommendations I fully support, but how do we then change the methodology of working together to make this more impactful?
I think you make a relevant point, especially around the premise of where place has its sort of work stream of prevention, which will be key here in addressing some of those outcomes. So, point well made there, Neil. Sally?
Thanks. It was in response to Neil's point, actually, which I think is really valid and helpful, particularly in the context that we're in today, because actually in the afternoon session where we're trying to work through the recommendations from the LGA session, the place paper and how we start to mobilise and do things differently with obesity as a worked example. So we teed it up nicely to just think about and challenge ourselves around how do we do that, but with thinking through this as an example. So yeah, it's good.
Thank you very much, Sally. John?
Thank you, Val. This is a really difficult area because of the evidence base, and this is a real challenge for colleagues in public health, is to sort of weave through how do you get sustained weight loss, healthy weight at a population level. And I think a few examples of sustained weight loss at a population level come in Cuba from the collapse of the Soviet Union. That was a good example where people run out of fuel and have to exercise more, have fewer rich foods to eat. Saw an overall reduction in obesity in a population. We probably can't go back there. I don't think we can replicate that. So I think what we want to explore this afternoon is what are the fewer high-impact evidence-based initiatives we want to take forward. So physical activity rates of younger people, we need to drive that up considerably. Val touched on free school meals and making sure the uptake of that. We have opportunities we can get better at. We do have to discuss novel medicines and drugs and their role, however expensive they currently are, their role in tackling obesity, particularly in adults. So that's what we want to explore later, is what are the things we do more systematically, but most importantly, do locally and individually with people, because this is very much about personal choice and behaviours that you're trying to influence. So it has to be very tailored and personal to the individual if we are to be effective, notwithstanding the collapse of the Soviet Union and its impact on Cuba.
Thank you, although John has recommended that we put that forward as a recommendation as well. So I will take Liz and then Mark, if that's okay, and then we will close questions if you're all right with that. Please forgive me if anybody wants to, but I'm more than happy for you to link in with Val after the session is over so that you can speak to her on a personal level. Thank you.
Thank you, Chair. I'll be brief. I remember sitting in the first workshops when we set up all of these targets and we wrote the strategy. And the struggle I have with this report actually is I don't really know whether we met the target or not, because there's so much in here that I can't tell. And I think going forward it would be easier for all of us to hold ourselves to account, to just to have a much more concise set of data, and I realise that may not work for lots of good other reasons, but I don't know how we're doing on this. I really don't.
I think that was really honest, actually, Liz, and I appreciate giving that. This is exactly an example of what this board should be in terms of giving feedback, and we should take that on positively, sort of moving forward as to what our measurable outcome should be. So, no, thank you. Mark.
Thank you. I think just building on what Neil said and also what John said, I think if we're going to do this, we have to look at what the bottom-up approach, if we're trying to change people's lifestyles and attitudes, then that can't be a top-down. It has to be a bottom-up. You have to work with those communities and those neighbourhoods. And I think we've done well so far, and I think part of the reason that we've done well is because that has been the case. So we just need to build on that, I think.
Thank you, Mark. Kate, you really quickly, but I don't have the heart to refuse you, but that's the last question. Thank you.
I love it. That feels powerful. Just to underscore, I think what Neil's saying isn't wrong, but at the same time, I think what we've got, and we've heard this morning, we've got examples of, if we get the specification right, liberate place, understand the value of neighbourhoods, and how actually that added value from starting at that point to deliver the ask, I think is our future. And I think we've got a broad consensus of support that that's the way, but it's going to take time to grow into the space.
Thank you for all your comments. Now, what I was going to say, Val, because I'm sure you want to come back on a lot of these points, in the interest of time, would it be okay for me to request, possibly, humbly request, Val, if you could email the board about some of the comments that have taken place in your response to them? Would that be okay, or too much to ask?
I can't resist saying I'll humbly accept that invitation.
Thank you. Really grateful, because I know how much hard work you've put into this, so incredibly grateful. The only thing I wanted to say was around, I think there's a greater piece of work here around licensing accessibility of fatty, salty foods compared to more healthier options. And you just have to, as a sort of a litmus test, go down Lincoln Road and have a look at the accessibility for fresh fruit and vegetables compared to takeaways, which is worth thinking about. So thank you very much. So we will move swiftly on to the recommendations which the Health and Wellbeing Board are being asked to approve. So A, the progress made against the 2030 ambitions, B, the proposed refreshed strategic framework for addressing obesity, and C, the board actively provides support for implementing the strategic framework. So we're all in agreement with that. Thank you very much. Thank you. Now, moving swiftly on, we have agenda item number 8, which is being presented by Sally Cartwright, Raj Lakshman, Val Thomas again, Kathy Hartley and Ian Green. You've got your work cut out for you, Val. But this is the Health and Wellbeing Board ICB Strategy Priority 24 to 25 update. Thank you. The floor is yours.
Thank you, Shabina. And we'll take it as the paper's been read. There's just a few slides, you'll be pleased to know, to talk us through the very bulky paper. So if we go to this slide, I think this is just for new members of the board. This is what our health and well-being strategy says. We want to have healthier futures, and there are three ambitions: giving children better outcomes and reducing premature mortality and reducing inequalities. And then there are 4 priority areas and how they fit in with the NHS operational plan as well. So that's our wall for the health and well-being strategy. And then in terms of the data, I know, Liz, you wanted us to say how are we doing. There is a data dashboard that's updated, and all the priorities have set targets for how we are going to get to where we want to be by 2030. And for priority 1, it's good level of development. We are on target, so those yellow is on target. Not in employment, education and training. We've seen from previous presentations we are not doing well and we are not meeting our targets. In terms of childhood overweight and obesity, we are on target. Adult physical activity, we are not on target in Peterborough, but okay in Cambridgeshire. Just to say, I haven't done statistical significance, looked at it for statistical significance, but the data is all, there are graphs and slides 3 to 7 on your packs. In terms of priority 3, we have children living in relative poverty, again on track, but the 2 other ones, long-term sickness for working age and universal credits, we're not on track. And we're doing very well on, not very well, but we're reducing children and young people's mental health referrals. That is on track and better. And so in terms of the priority 1, just a summary from those slides in the pack from slide 8 to 10. We have done the joint strategic needs assessment, which we brought, and then we've got 5 strategic recommendations from them, and we've done some action plans to take those recommendations forward. We've recommissioned services, which are big public health services, Healthy Child Programme and the School Age Health Improvement and Prevention Service, which are place-based and which are outcome-focused. So we've got those outcomes within the delivery and the key performance indicators for those services, and they are place-based as well. We have commissioned emotion-based school avoidance service, and again, we see these young people not in employment and work, and we are also seeing a lot of them not in school. So if we have to address it at that level, school is a safe place. If they can't be in school, then it's going to be more difficult for them to be in employment. So how to get a lot of these, and persistent absenteeism has gone up post-pandemic. So that's one of the focus that we've had. Peterborough has received Family Hubs funding and a lot of work going on, again, details in the pack. In Cambridgeshire, we've launched Inclusion for All, which is a program for children with SEND. There's something similar in Peterborough, but it's not called Inclusion for All. It's about addressing the increasing number of children having education, health and care plans, and how do we meet their needs rather than waiting for them to only have a diagnosis, but actually holistically meet their needs. And then we've had quite a few different approaches to improve immunizations, and uptake has improved in Cambridgeshire and Peterborough across, although in some of the childhood immunizations have been declining in England, it's done well, and Cambridgeshire was the highest nationally for the flu uptake. A lot of work done through the School Aged Health Improvement Partnership. Priority 2 and 3 we finished.
You've probably heard enough of priority 2 and 3.
Val has covered all of that in her deep dives, and then priority, the next one. Yeah, and Ian will talk about that.
Thank you, Raj. So priority 3A is reducing poverty through better housing. Quick 3 deliverables. So 1 was actually trying to get a better delivery vehicle for housing interventions across Cambridgeshire and Peterborough. And I'm pleased to say we've got the Housing Board for Cambridgeshire, Peterborough and West Suffolk to take that on. So we now have a new housing and health subgroup to drive that work forward, which is really positive. Someone's passage running low. Val? Quick. We're continuing to work in terms of gathering better data. So David, who's sat behind me, has pulled together, along with Sue Beecroft from the Housing Board, all the different housing needs assessments into one place. So rather than having to work out what the housing need is across Cambridge and Peterborough, that now sits at Cambridge Insight in one particular folder. So it's all together. So that's brought together all the survey work that's been done through lived experience, plus all the surveys that's been done via the district councils. And the last deliverable is really about trying to address better housing and housing standards. So we've done some work on cold damp homes. We've piloted some work in Cambridge City. We've now taken that on board in Peterborough, and we now have a project looking at a better referral network, and we're hoping to trial a project in a local GP practice in Peterborough to get that seamless transition between somebody living in a cold damp home who may have a respiratory condition to the actual help and outputs they need as occupiers. And we're working with Eclipse and some of the data packages within the NHS to try and tie data that we have in the public sector through public health and local authority with NHS data to actually do some proactive targeting of people in need.
Okay, so I'm going to talk about priority 4. That's to promote early interventions and prevention measures to improve mental health and well-being. So the work that has been done is, well, there's different areas, the sections within this priority. The first one is on communications and information. So we do know that we need to improve communications about mental health to the population. Particularly, we have been developing, as you're probably aware, the How Are You website and the Keep Your Head website. So these two websites contain information about how you support your own mental well-being and what support you can get. So we have been trying to promote both of those websites, and particularly through outreach into communities. The second work stream that we work on is on motivation, how we motivate people to do the things that are good for their mental well-being. So this is very much a place-based piece of work, working with integrated neighbourhoods, and particularly promoting things like lifestyle medicine approach. And there is now a new resource on the How Are You website, particularly focused on people with serious mental illness and how they improve those lifestyle factors and engage people in lifestyle medicine. We're also working with children, young people through the full scope work, and they are looking at doing some co-production with families and children, young people to understand holistically what supports people in their mental well-being. As far as the relationship work stream, we have been working with you as a system to try and understand trauma, and held a workshop on the trauma-informed system. More is to be done on this, but certainly we are working with Changing Futures, who you're probably aware of, looking at that sort of trauma-informed approach and the trusted person approach to support people. Loneliness is a massive area, and there's been work currently to understand more surveys around understanding loneliness across Cambridgeshire and Peterborough. We have a network called NAILCAP, which brings together organisations that work to address loneliness, and that has continued. But ideally, we'd like to sort of have an addressing loneliness strategy moving forward. And I think Raj mentioned the emotionally based school avoidance work. But what I do want to end on is the wider determinants of mental health. So we published the results of the mental health GSNA this last year. And within that, there's quite a few recommendations. But one is the importance of addressing poverty for mental well-being. And another was around this anchor partnership, anchor institutions work, which is so fundamental to support people in their mental well-being. So those are two areas we're focusing on.
Yeah, I think the last slide was about what we asked from the board. I think it's there in the paper, but for prior, unfortunately...
Sorry, technical support has failed.
Yeah. So I think we would value a discussion on what the board can do to support all these 4 priorities. They're in the paper on the last page, on the main paper. It's a short paper, so it's on the last page. So for priority 1, we wanted to unlock the practical barriers for people working together across organizational boundaries, all that we've been talking about in multidisciplinary teams at place, sharing data, sharing IT support, and if there's a relationship with a voluntary sector organization, they should be able to access support from the specialists so that they can support this family who they have or this person who they have the relationship with. We've asked for a commit to a single public sector ethos so that we share estates, resources, workforce, and risks with the unified aim of improving outcomes for our population. So keeping the person and being able to work in a holistic way, irrespective of organizations, and so that we avoid some of the duplication. For priority 2, Val has suggested identify how they can integrate findings of behavioral insights. I think Val covered some of those recommendations in her presentations. For the priority on housing, we are again saying engagement with the neighborhoods and place. For priority 3, again, Val has covered all of that. And for priority 4, Kathy's asking for how do we promote and communicate all these mental health resources that have been developed that can help people help themselves quite early on, rather than all of them just being sent on to services for thinking that there's some magic solution that a GP or a mental health service can provide. There's lots of resources that people can use to help themselves. So how do we have that? I don't know if you want to add.
Sorry, just mindful of time with 2 minutes left till 12:30. So did you want to add anything at all, Kathy, to that? Are we all okay? Is anybody wanting to ask any questions or add to the discussions? Yes, Neil.
Just so you don't hold to time. I think what in all of these conversations, I think absolutely I believe that integrated neighbourhoods, general practice, voluntary sector, communities absolutely should be driving a lot of this agenda. I guess the nagging thought I have is, how are these connections going to happen? So one of the risks that I think we have is that we say, well, integrated neighbourhoods are the answer to all of the system's problems. Now, they could be, but for that to happen, integrated neighbourhoods for many, I truly believe that in Cambridge and Peterborough we are further ahead than a lot of the country, because we've got things like integrated neighbourhood managers. We've been working on this agenda for quite a long time, probably more than most of the rest of the country. But and so involving them in delivering all of this stuff is really good and really sensible. But I think we need to make sure that that connection does happen, because I worry about my other integrated neighbourhood colleagues going, well, I didn't know I was supposed to help with that. I didn't know that I was meant to be moving things along. So how do we make sure that integrated neighbourhoods are front and centre, but that we make sure that actually we are challenging those integrated neighbourhoods with this agenda and they're accepting that challenge, which I'm sure we can talk about more in our development session later in the afternoon.
I think that's a really good point. Actually, it might be worth taking what Neil has said and emailing us back with some of those proposals, if okay. Any other discussions, comments or questions at all from anybody else? Yes, Heather? Thank you.
Sorry, thank you. Just a point about working to integrated neighbourhoods, or connecting to integrated neighbourhoods and working through integrated neighbourhoods, because integrated neighbourhoods are actually all of us. Yes, there is one programme or project manager per neighbourhood, but they don't do most of the work. It is everybody.
Thank you for that. Any more questions? Yes, John? I knew you were going to come in because this is your baby.
Yeah, so thank you, Chair. Thank you for predicting it. So I think it comes back to what can you access in your neighbourhood. So when you look at some of those things, actually, what is it like to get mental health support in your neighbourhood? And I think we should have a look at what that baseline feeling is like, what's the experience, what's the access, what are the outcomes, because it helps us get better. And I don't think we know. I think we get some good feedback from individuals, but I don't think we know what quantity of care is provided, who it's provided to, more importantly, who doesn't access it as well, who might need it. And I think that helps the neighbourhood, actually. Can we improve that access? Can we improve the outcomes and the equity of outcomes of people by knowing that? And I think when we look at these things, I think that's some of the challenge we should have, is what does it look like, what does it feel like, and get into our JSNA very clearly, because you're showing the summary of that. is actually how do people experience it, and then those neighbourhoods can thrive if they can give and support the right access to people.
Thank you. I think that was very well said as well. And I also think that there is everything seems to be attributed to place now. I think place is the golden word for today. So we want to park everything with place, but actually we still have a role to play. And I think that sharing of information is something on my radar. If we can strategically share information across systems so that everybody has a look in who's involved within that one individual who is accessing those services, then it can speed up our efficiency, obviously can become quite cost effective, and tying in with those three main work streams of digitalisation, prevention and accessibility will work very well, so that we don't lose sight of the patient, as Jonathan said at the beginning. Yes, Mark. I think, Kate, you had your hand up.
I'll save it for the development session.
Okay, thank you.
And just really quickly, is there then a role for something around a community resilience JSNA that starts to look at some of the issues that John's talking about, to say, how do we look at what is available in different communities, and how do we fill gaps and ensure that the communities are getting what they want rather than what we think they want?
Thank you. Can I ask that we take that point back actually and feed back on some of what you think that we can do? Would that be okay with yourself, Mark? Yes? Right. So if there are no further questions or comments, I'm going to move very quickly to the recommendations, which are to note the progress against the Health and Wellbeing Board Integrated Care Strategy priority areas made over 24-25. B, to discuss support requested from the board. And are we all happy with those recommendations? Yes, I see no objections. I don't see any online as well. And agenda, thank you very much for presenting, all four of you. I think that was a valuable piece of work. Thank you, and I'm sure that we will allude to this more in the development session. Right, we're going to agenda item number 9 before any other business, which is our forward agenda plan. Has everybody had a chance to have a look at the forward agenda plan and agree that our meeting ahead is a meatier enough agenda? Do we need to add anything at all? Any thoughts? No? Thank you. So I think that the next item on the agenda is any other business. I don't see anybody with their hands raised, neither do I see anybody online. Well, I'd really like to thank everybody for attending today. It's been a wonderful meeting. We are 4 minutes overdue to our proposed closing time, but it's been fabulous speaking to all of you here. So we have a very important meeting on the 18th of June. I'd just like to say it may or may not be the last time you see me in this position, but if it is the last time, I'd just like to say what an absolute pleasure it has been working with all of you, and no doubt I look forward to working with you outside this scope if the eventuality is the latter. So thank you very much. Thank you.